So, you have a pretty good idea of why your appetite is reduced. What now? Hi, my name's Luke from Active Health Clinic, and welcome to my second video in my appetite series. And today we're going to talk about beginning to get your appetite back. And before we really get to that, I'd love to tell you a story. This story is going to be about you. I want you to think back to when you were 5, 6, 7 years old, prep grade 1 time. And I want you to think back to how your day was scheduled around your food. Because if you think about it, it actually was. You woke up in the morning and most likely you ate breakfast. And then you went to school and you had fruit snack. And then you had lunch. And then you came home from school and had afternoon tea. And then, or a snack after school. And then you had dinner and went to bed. And that was pretty much it. When we've lost our appetite, or when it's markedly reduced, our body loses sight of that really regular routine that we were in when we were a kid. Our bodies are creatures of habit, and our brains are creatures of habit, and we love this routine. And even more so for people who live with chronic health conditions, their body actually thrives on having a routine, and their brain thrives on having a routine. So to understand where we need to get to begin to stimulate your appetite again and get it back, we need to understand what was going on before you lost it in the first place. This analogy of going back to when you were 5, 6, 7 and thinking about the way your day was structured with food is a really important process to undergo, because it helps us to remember a time, one, when we actually had an appetite, and two, what that structure actually looks like, because it will give us an idea of where we need to go in order to get that back. So from this, what do you need to do to get your appetite back, or to begin to stimulate your appetite again? You need to go back to the basics. You need to go back to what that appetite or food situation was when you were that age. And it literally needs to be as simple as that. If you'd like to have more advice on this, or talk to a professional about how to actually go through this process, please don't hesitate to put up your hand and reach out. And someone will be in touch with you to be able to start that journey with you. If you found this video helpful, or you'd like to see more videos in this series, please like and subscribe. And if you think there's someone that you know that might benefit from this video, please tag them below. At Active Health Clinic, we're trying to reach 1 million people about invisible illnesses by 2022. And you doing those things will help us to reach that goal even sooner, hopefully. This is Luke, and happy eating.